Welcome to Public Health Matters, where we talk about what matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services. And before we introduce our guest today, I'd like to give you a really brief COVID update. So as many of you know, the federal emergency has ended on May 11th, but that doesn't mean that COVID is done or done with us. So please take precautions if you're in tight, cramped spaces with a lot of people, and think about keeping those windows open and wearing a mask. Also, if you think you have symptoms of COVID-19, there are free antigen tests available at the Public Health Department. So just give us a call at 589-4500. Don't forget the area code 603, and get one of these FlowFlex COVID-19 antigen home tests. And then if you do have symptoms of COVID-19 and you've been diagnosed with COVID-19, there is Paxlovid, which is available to treat and reduce the symptoms and help you recover faster. So start with your primary care provider and see if you can get a prescription for Paxlovid. And if you are unable to reach them, you can call 1-800-818-5803, and on-site medical services will help you get that Paxlovid prescription. You do want to take that pretty soon after the onset of your COVID-19 diagnosis. So it is Mental Health Awareness Month, and so I'm just pleased as punch to have Lisa Vasquez here, our behavioral health strategist. We're both strategists. Here to talk about mental health and mental health awareness and behavioral health and what behavioral health means, because you know, we have like this umbrella term. So welcome, Lisa.
Hello.
So tell us, what does behavioral health include in its definition?
So I think everyone knows what mental health is, but behavioral health encompasses mental health, suicide prevention, and also substance use disorders. So all of those things are encompassed in behavioral health.
So it's like a big umbrella term for three things. And so it's Awareness Month. And so let's start with how we need to become aware of our mental health, our own personal mental health, but also to recognize signs and symptoms of our friends, neighbors, family, and how we can help them access resources as well. So what are some of the signs and symptoms that you might be, it's not just the blues, it's something a little bit more?
So I'm going to start off by saying that we all have mental health. So I think that for a long time we've seen the word mental health as like, ooh, that's that bad thing that goes on, but it's really the health of our mental status. So we all have mental health, and we can all work towards mental health well-being. And I think that's important to start off with. Some people don't feel comfortable talking about mental health, but we should all feel comfortable to talk about it, how we're feeling, our emotions, because the more we talk about it, the better we feel about it. So when we keep things bottled in, that's when we see negative mental health well-being. So that's just to begin. But when you're seeing any changes in people, in their behavior, and that behavioral health comes in, in their behavior, you want to pay attention to that. So any drastic change in behavior is something that we want to pay attention to. So it doesn't have to be necessarily all like negative. So some people are like, well, I've noticed that someone is sleeping more, they're not interested in the daily activities, or activities that used to bring them pleasure doesn't seem to bring them pleasure anymore. They don't want to do things that used to be fun for them. So those are obviously some flags, red flags that we want to pay attention to. But if you've seen that for a while, like that, you know, low energy, sleeping a lot, not really engaged with people, and not doing things that they normally do. And then all of a sudden you see a drastic change to being like very energetic, and total opposite, you also want to pay attention to that and see what is the reason for that. So any drastic change in behavior in either direction is something that you want to pay attention to. Try to figure out what's going on, what's causing that change, and having conversations about it. So it's also important to, especially with the kids, because if they're your kids, you have access to them all the time.
Right.
Making sure you have conversations about mental health hygiene, about like self-care, all of those things are really important. So it's not a one-time thing of, oh, I see something's wrong, let me talk to you now. It's a conversation that we have all the time. So kids don't feel like on guard when you're asking them. So those are some really great tips. But you can also do that with your family, with your friends, because you should have that comfortability to talk to them about some of those things. So if you're seeing changes in your friends and your coworkers, in a family member, you should feel like you're able to say, hey, I'm seeing some changes, what's going on? And that's not something that you should feel bad about. You're not saying anything. You're not saying something's wrong. You're just saying, I'm just seeing a change in you. What's what's happening? What's
Kind of
going
the
on?
elephant in the room, and it's okay to acknowledge it if you're
100%,
noticing changes in
yes.
people. But you mentioned kids, and so to me, like this is a big thing because we do have a lot of really children and adolescents, a lot that because of COVID that got exacerbated, the isolation and the readjustment to going back to school. And then I think of my own teenagers who might just want to hide in their room. And, just how do you differentiate? Because that is a very teen behavior. Like, oh, just go back into the room, use their computers, use their devices. How do we know when it's like kind of cross that line?
Yeah, and that's again where you need to pay a lot of attention to what's that change in behavior. So if your kid has always been like that, they're kind of like to be on their own, or they're really into gaming, then it's not really a change if that's what they're doing. But when you see those drastic changes is when you really want to pay attention. But also there's things that you can do to try to get your kid out of that room, right? Engaging them in family dinners, family game nights, having events outside of the home, as a family where everyone is included, so they feel like they need to join in because everyone else is doing that and they don't feel singled out. Those are really good ways to kind of get your kiddo out of that room if they're really into being alone.
Yeah, or sleeping in there.
Yeah. And some of those things, again, are like developmentally totally normal.
Yeah.
Because teens do need a lot more sleep than they think they do and that we think they do. Most teens need about 9 to 10 hours of sleep. And most of the time, they're getting about 4 to 5 hours of sleep. If they have like a TV in their room or electronics in their room, they're probably getting 4 to 5 hours of sleep or even less.
Okay,
So
well, I'm doing that right because there are no TVs.
yeah.
Sometimes the phone is there though.
Yeah, so even if you're seeing that your kiddo is struggling in the mornings, saying, why don't we put that phone out in the hallway or somewhere else? I know a lot of kids are like, well, it's my alarm clock.
Right.
Get them an alarm clock. It's okay. They're
Right.
not that expensive.
I have one. So, speaking, again, we're still on teens, but it just, as we have this conversation, it makes me think of social media and the pressures and the stress of social media and the whole idea of the phone and getting the phone out of the room and out of their hands. So it just seems to me it's become such an extension and it can really exacerbate, I would say, poor mental health. Because they're comparing themselves, people fix up their pictures and I don't look like that. Well, it's impossible to look like that because someone just spent an hour making themselves look good, but they don't necessarily understand that. So I do think like that is a tip for, phone out of the room, just not always with it. We don't let anyone in my house, not that we're perfect, but there are no phones at dinner. That's our time to like talk and be together and get away from that distraction.
I wholeheartedly agree. It's really great to have those little bubbles of time where you're away from screens, away from like social media, and are able to have some one-on-one or present time. Because how often are we really present in the moment when we're half of the time checking our phones? We're really not having any interpersonal one-on-one time. So it's really great when people have that. But also I read this really cool article about some girls who decided to go back to flip phones. And it was just a group of people. They're like, we don't want to deal with the social media. They went back to flip phones so they could still communicate with their parents and things like that if they needed to, or their friends. They could text, but they weren't they weren't online.
How long did it last? Because my husband did that for like 2 years, but then at one point he's like, I have to have this for work. So.
They still feel pretty good about it. So they were saying how great their mental health has improved since they did that. They're still connected. They're just not connected to like that social media aspect.
It's too much. So I found some fast facts about behavioral health, and I couldn't help but think that in the United States, there are only 645 specialty behavioral health hospitals. I just think that's not very many.
Yeah.
We have had a trend in our country where a lot of the hospitals were closed. A lot of the psychiatric hospitals and otherwise were closed. And so now we have this incredible deficit of mental health resources for those in dire need. And also just even having that 11%, let's see if I can even read this, 11% of the U.S. hospitals have a specialty of behavioral health. So that's really small amount as well. When you think about where people are going, they're showing up in emergency rooms because there are no other resources in the community. So how do we advocate for more resources, or, where do we go from there?
So
I know that's a big question.
Solve the problem, Lisa.
Exactly. Please tell us what to do.
So I was talking to someone the other day, and I was saying, like, our problems look like so big sometimes, and we know what we need, right? We need money and people, resources, right? But sometimes whatever we create, whatever small little initiative we have, like getting those things started so we're able to collect some data of that actual need. I think that's so important. So then we can say this is the need and then get those people and that funding.
Yeah.
So I think sometimes starting something, even if it's small or if it's like a pilot or a soft launch or something small, can be a big catalyst for change, because then you can get the ball rolling, one. Two, you can find out and gain some data about the need, and then you can actually get funding because you have this data that says this is our need. So I think that's one of the things that we can do long term to see some solutions happen.
Yeah, we have to kind of bite it off small bits at a time, but even so, it's just like amazing to me, just how few services we have and what we've done in this country. And we're coming off of a pandemic where mental health has become really at the forefront of everyone's mind.
And I think it's something we see commonly, that whatever the issue is, like right now, we're gonna all focus on that one thing, and then things fall to the wayside because we're so focused on this one thing.
You have to pay attention to everything.
And then we're like, oh no,
yeah, look what
whack-a-mole
happened.
over there. So yeah.
And speaking of which, so I've noticed since 2017, the suicide prevention services have increased in hospitals, which says to me there's been a lot more attempts at suicide. We're seeing it, in the younger population. We're seeing it in all types of people, whether they're celebrities, youth. It doesn't really matter. So just some tips, again, about how we talk to people about that we're worried about. I know one thing you taught me a while ago, probably one of my earlier shows, was that it's okay to ask someone if they're thinking about it, because it doesn't mean they're going to do it.
Yeah, because if they weren't thinking about it, they'll say no. So it's you have to be direct. You can't like beat around the bush. So if you are concerned about someone, straight up ask, are you thinking about killing yourself? And specifically those words, because it can jolt them a little bit into like realizing that's what they were thinking. If we use words like harm yourself or things like that, they don't really have the same meaning. There's self-harm behavior that's not necessarily associated with suicidal ideation. So we really need to differentiate that when we ask. And then if the person says yes, sit down with them, call someone, and stay with them until help arrives. Do not leave them alone.
Yeah. So, I mean, it's really, it isn't, I did use the word harm recently, so I have to work on that. Because it's just, I know that you said it's okay to ask if you're worried, dealing with kids that are away and, not close by, sometimes that you can feel the stress when you're talking to them. So I just put it right out there as well.
Yeah, and sometimes it's scary to say those words. For even when you're asking, it kind of feels scary because what if the answer is yes? So being okay with the fact that sometimes it might be yes, and then you have to do something about it as well. And I do want to just put in or push or insert the fact that we're having a mental health first aid on May 31st. It's an all-day event. It's going to be at City Hall. The registration is open. It's on our Facebook page. But if people aren't comfortable or very computer savvy and they just don't know how to register, they can give us a call at 603 589 4538 and I'll register them myself. We want people to sign up. They'll be able to learn more about the signs, symptoms of mental health crisis. And I think more importantly, how to have a conversation with someone, because I think that's one of the things that stops people from having conversations or even bringing it up. Because saying, hey, are you thinking about killing yourself can feel scary to ask, but learning why is important to be, direct with that, learning about what resources are available in the community, knowing that you're not alone if you're going through that with someone is really important to making you feel a little bit more comfortable in asking those questions, in engaging with people about having conversations in mental health.
And it's so important. So I took the class, full disclosure, but it's so important, especially if you're working in human services, social services, any kind of work where you're working with maybe a challenging population or it can take a toll on you. So I really enjoyed the class in the sense that you're also looking out for your coworkers, you're looking out for your family. I know you have it for first responders as well. That's not the one you're offering, but it's still that same idea. If you're working in this, how do you identify that among the people that are closest to you throughout the week and what to do? So I think it's a great course. We'll try to pop up some information about that at the end so people can make note of that.
And part of that training is also self-care, because I think we so much forget about self-care all the time, but you can't take care of other people if you're not taking care of yourself. So that's super important that people realize that they need to have a little gauge for themselves. How am I feeling? Am I feeling, full? Am I, am I a medium? Am I running on empty? Like, that's really important for you to see. Are you getting enough sleep? Are you, eating okay? Are you exercising? Are you taking breaks when you need to? Do you feel overwhelmed with the, if you're working in social services, for example, and you have a big caseload, is it overwhelming? Do you need to take a vacation or something to kind of refill yourself and feel back to your norm?
Right. And I think it's really important for people to remember to not only, as you said, to take that time, but if you're running on empty, you're not doing much good for your clients. So, it's there's that sense in the air, so when things are going poorly, you take that day off. Someone can cover for you. Nobody's indispensable.
Yes.
Yes, it's unfortunate for that, maybe those clients that can't see you that day, but it's okay. Someone will either cover for you or you'll just reschedule, and that's, you're already conscientious, so but take that time off.
And I think one of the things we forget as parents is that when we take care of ourselves and our kids see us prioritizing ourselves, they learn that they can prioritize themselves and that self-care is important. So we always put ourselves last. They're seeing that. They're seeing that as a person, we're not as important and that they don't need to prioritize themselves. So I think if we practice good self-care, our kids will see that and they will practice good self-care as well. So not only...
It's funny because I'm thinking of some of my kids and they have no trouble practicing self-care. They're like, they're in that stage of like me, so.
But also I think like the new younger generation is a little bit more able to verbalize their needs when it comes to their emotional needs and self-care. And I think that's great, and we should talk about that more.
Absolutely. So we talked a little bit about suicide prevention in children. There's so many aspects to behavioral health, but there's maternal mental health. So we talked about taking a break, recharging, role modeling for your kids. But when you think of maternal mental health, we think everything from, being pregnant to delivering that baby to potentially having postpartum depression, and then also or having the blues. That may not be the full-blown depression, but how to process that. And no one ever said motherhood was easy. So there are some moments that are very difficult, very isolating, exhausting. So any tips?
Yes, many tips. I think it's important from like even before you're thinking of if you're planning, if it's a planned pregnancy, and if you're planning it, making sure you're taking time for that self-care, making time for the gym, making time, like creating a schedule for yourself so you have that self-care, because it's harder to get on the other end.
So build
right?
it in before.
So build it in before. And then while you are pregnant, making sure that you are, I read this somewhere about like during pregnancy, making sure you have a positive environment and surround yourself with positive people. That's really important for your own self-care, but also to feel supported during the pregnancy. Sometimes pregnancies are difficult, whether it's morning sickness or it's just like the hormonal waves that come by, as part of it. Yay. All of those things.
Yay.
It's really important to feel like you're not alone, that you're supported, that you have a support system. And then afterwards, that's even more important to have that support system. And one of the things I say is there's so many moms in this world, right? We have moms, we have aunts, we have grandparents, we just have a lot of other people around us. And it's up to us to say, hey, I need some help sometimes. And also not feel like we have to be super women all the time. And when help is offered, take it. So sometimes I feel like people feel bad taking in help. If someone says, oh, can I come over and watch your kid so you can take a nap or something? They're like, no, I'm fine. No, take that help. Take that nap. It's really important.
I wish someone would come over and offer me that right now.
It's really important. So making sure not only that you surround yourself and create that support system, but being able to say yes to help is also really important. There's nothing wrong with saying yes to getting some help. One of the things that when I talk to kids, I talk about is the fact that superheroes all have sidekicks because everyone needs help sometimes, even superheroes.
Good idea. Yeah.
So,
Batman, Robin.
Yeah, they all have superheroes.
Who's
Sidekicks. He has Superboy, and then he has the Crypto, which is the dog. So,
okay.
you
more
can
up on
tell.
this now
You can
than I
tell.
am. I can see it,
I'm into
boys.
comics.
Yeah. So I wanted to go through, we have an amazing community in Nashua. So
We do.
Nashua, Greater Nashua, we have a lot of resources around behavioral health, mental health. We have this wonderful, this is a tiny little one, but we have some posters all around in the libraries, all around town, in different agencies to let people know mental health is essential. This is probably my favorite guide that we have in our office. We have it in Spanish and we have it in English. And
We have posters in Portuguese.
Yes.
We have,
So we are really trying to reach out because it's not just a black and white problem. It affects everybody, and so everybody can use some help. So I wanted to talk to you quickly about some of these because people are wondering why they have to dial 603 now with every phone number, and that's because we have this New Hampshire Rapid Response. Or is that wrong? Nope.
It's
That's
the
not, excuse me,
national
with the
988.
National Suicide Prevention Hotline, which is 988, and that is, incredible that we have this national resource. But because of that, in order to make it work, you now all have to dial 603. But it's okay; it's worth it. So we have that, and then we do have New Hampshire Rapid Response, which is a 24-hour crisis line, which is 833-710-6477. We have the doorway. You want to explain a little bit about the doorway of Greater Nashua?
Yes. So the doorway is really like the gateway to treatment, right?
It is exactly what it says.
That's what I like to call it. So you can go to 268 Main Street from 8 to 5 and be linked to someone who can help you find the right treatment that's appropriate for you, depending on if you have an alcohol use disorder or opioid use disorder, whatever it is, and they can do an assessment same day and then get you connected to that treatment. If you need help after hours, because things happen when they happen, we all have lives, you can also go to, I think it's 63 Temple Street. Pretty sure that's the address.
Okay.
But if
here.
I'm wrong, you can call 211 and they'll let you know the right address and connect you to it. So there's somewhere where people can walk in 24/7 right now in Nashua, which is amazing. So if it's 8 to 5, you can go to 268 Main Street. And if it's after hours, call 211 and they'll let you know the exact address.
And that's mostly for substance misuse
That is for
disorders.
substance use.
And We have Greater Nashua Mental Health, an amazing
Yes.
center right in the center of Nashua.
And they have open access hours, so people during those hours, and there are different hours on different days because they want to accommodate people's schedules. So they can just call the number there and get to know when the next open access is. And during open access, they can get an assessment as well to see what level of care they need, and then they'll get assigned to someone. So it's awesome.
So we have Harbor Care, and that really serves our veterans
Yes.
in the area. And
They
then,
also have mental health services and substance use services. So I think we have
a ton of
we have-
resources,
we
which is
do have-
really amazing
yeah.
when you think about it. We also have, just to list these off because we're running out of time,
Okay.
the Trans Lifeline, the Trevor Lifeline, and the Veterans Crisis Line. So there's just so many things that if people need to reach out for help. If you see one of these orange little flyers around town, please grab one. And this one is great because it folds up and it can be a pocket resource as well. We also have more of a preparedness one, a lot of the similar resources about how, again, that mental health first aid, that self-care, how to reground yourself in a time of crisis. We have this great little pocket resource as well. But the bottom line is, and this is a campaign we've been doing with our chronic disease work group as well, is that courage is knowing when to ask for help. Help is out there. You have to ask. We have been really encouraging people since the COVID restrictions have lightened and the emergency order is not in place anymore. Go back to your primary care provider. Start there. That's just the best, fastest way to access help. And if they have a wait and you can't get in, you say, I need to get in. So that's just really important. We want people to access primary care first. And then I just want to mention a little shout out for our Community Connections Resource Guide. You can go on our website and see these wonderful boxes. There's immediate services, general health services, mental health services, and substance misuse services. So having all four of those well categorized, just go onto the DPHCS website. That's the Division of Public Health and Community Services. And if you search for that Community Connections Resource Guide, you're just going to have all sorts of resources pop up for you. So Lisa, thank you. So much work to be done. You know, you and I could talk for another half an hour.
Yes, we could.
But we're not allowed to today. But thank you for coming and for all those great tips on keeping our minds clear, working on ourselves, helping others. Just so important. And I guess the last thing we'll say, to go out with a bang, is like, there's no shame in having a mental health problem. And that's where we want to really get away from that stigma.
And I really want to give a shout out to NAMI New Hampshire. Their mental health awareness campaign is more than enough. And I just want everyone to kind of have that hashtag and think about that. You are more than enough. You are more than enough. I am more than enough. We don't need to compare ourselves to other people on social media. We are more than enough just by being who we are. And just think about that when you're thinking about your mental health. You are more than enough.
That's awesome. Well, thank you so much. And thank you for coming on today. Just a few reminders for our audience that we are still looking at type 2 diabetes. And so when you're at that primary care doctor, have your blood sugar checked. Is it over 100? Make sure you know that number. Because diabetes risk is related to your blood sugar level. And is your blood pressure over 120, over 80? Again, know your number and know your risk. And finally, we'd love for you all to visit our health clinic at 18 Mulberry Street. We have immunizations and lead testing on Tuesdays from 4 to 7 and Fridays from 9 a.m. to 12 p.m. And we have a sexual wellness clinic by appointment, please, Thursdays, 3 to 6 p.m. And I want to thank you all for joining us. And remember, public health matters.